My name is Dr. Jemima Kariuki. I'm a postgraduate medical student doing my residency in obstetrics and gynecology. During the COVID pandemic, we realized that many women were coming in with very poor fetal outcomes, rather delivering children with very poor fetal outcomes. And across the country, we would hear reports of women coming in the morning with bleeding for over 5 hours, placentas that had been in there for 4 hours, and even death. And in 2020, you don't anticipate that something as physiologically normal as childbirth would result in the death of 996 women every single day in Kenya. And this would result in a lot of devastation and loss of life. And therefore, decided to actually create a solution. What if our women were able to actually call a number and speak to a doctor and actually get to hospital in good time, in prompt time, without having to worry themselves about looking for neighbors or looking for the chief or walking a distance of more than 10 kilometers to reach their facilities? And what if that's something that we could solve as a people or as a nation? And therefore, Wills for Life steps in to have that solution where women call a particular toll-free number and they gain access to a doctor and they're taken to hospital either through an emergency service of ambulances or taxi, and they're able to get to hospital within the proper time. And therefore, we're able to save lives, we're able to help the children, we're able to prevent complications of childbirth, we're able to prevent maternal to child transmissions of vertical diseases, and we're able to do so much more for our women. And that is the gap that we are seeking to fill. Thank you.